up, y'all? It's your girl Taylor. If you're new, welcome, and if you're a returning subscriber, welcome back. As you guys can see, I am coming here today to give you a nursing school Q&A specifically for an accelerated nursing program, but I will try to kind of compare back and forth to a 4-year school or a normal school that just does semesters instead of like 5 or 10 week terms. I posted a vlog about 2 weeks ago. You can go ahead and click up here if you would like to see that vlog, but I did a day in my life and my DMs were flooded with questions about nursing school, so I decided why not just come here and make a video just to combine everything. And I know there's other people out there that are wondering about accelerated nursing programs or the difference between LPN and RN or ADN and BSN. So I'm just going to come here and kind of give insight on which program might be best for you, although you will be the end decision maker for what's going to be best for you. But yeah, make sure you guys subscribe to my channel, follow me on Instagram to keep stay updated, and we're gonna be coming back with the YouTube videos this year. So super excited. So let's go ahead and get straight into these questions. Duh. So one of the first main questions that I got was, what is the difference between an accelerated nursing program and how long is my program? So the big difference, honestly, one is just to get you out of school earlier, and two, the amount of time that your classes are and the amount of classes that you take at one time. So for instance, my program is a 5-week term, and every 5 weeks is a semester. And every 5 terms, we take 1 to 2 classes. So you're in a 5-week term, you take 1 class, you switch classes, you're in another 5-week term, you take another class, you switch classes, you're in another 5-week term. So you're taking about 3 classes a semester, but also we don't have a summer break and we don't have winter break. All we have is a week off in winter, and all we have is a week off for 4th of July. We don't get breaks, spring breaks. So the program, they're able to kind of spread out classes, whereas in a 4-year, you would take probably 5 classes in a semester because you're going to get your summer, you're going to get your month off for Christmas. We don't have that. So that is another big difference. And then another one, of course, is that you only take 1 to 2 classes in a term. Right now, I'm in pharmacology and dosage calc, but last term, all I took was nursing concepts 2, and I took it with a clinical. So that was 1 term with 1 class, but we also had a clinical on top, so it will be kind of hard to put in 2 classes. Normally, if we don't have a clinical, we'll have another class. So like with pharm and dosage, we don't have a clinical, so we have the extra class, which is dosage with pharm. Now, a 4-year, I don't know exactly when they start clinical, but I believe they'll probably start it maybe their 2nd year, probably their 1st year. Honestly, they'll probably just start a clinical. But again, you have 16 weeks to take 5 classes and do your clinical versus 5 weeks to take a class and do a clinical. So it's a difference, and it's something that you really have to look into, but you will get out faster. And that is the good thing, is that we get out quick. We don't have to wait the full 2 or 4 years. We just get out of school faster. So, okay. The next question that I have a lot is, what are prereqs for nursing school? So my school kind of included our prereqs, although I took all the prereqs already because I also graduated from a 4-year university. But our school includes all the prereqs. So how can I explain this? For a 4-year program, or even for a lot of programs that aren't 4 years, most of the time, in order to get a nursing school, you would take a TEAS test. You have to pass the TEAS test. And then they will make you take all your prerequisites, pass them with the grades that they want you to pass with, and then you can apply to the program and get accepted and move on. My program, you take the TEAS test. If you pass the TEAS, they will say, okay, they'll look over your GPA or transcript, and then you'll be accepted or denied. And if you're accepted, your prereqs are included in the program. So instead of you having to take prereqs for 1 year or 2 years, you can just come into the program and take your prereqs included. So I think that's really convenient for people who have never taken a prereq, especially if, you might be a little late starting with school, or you just want to get to the bag quick. You can have your prerequisites included. I do know that most of the time for prereqs, you have to get like a B or higher. And also in my nursing school, my nursing program, pretty sure it's like this for most, 80 is passing, and anything below 80 is failing. So if you get a 79, you failed your class with an F. You have to get 80s in nursing school. They don't even allow C's. It's not even a thing. And so that takes me to the GPA, because a lot of people had questions about GPAs. So the GPA to get in is definitely going to depend on the school. But I know that most schools, to maintain in the program, it's probably like a 3.0, because you can't get below a 80, which is a 3.0 on a grading scale. It might be a 2.7. No, I believe it's a 3.0. I think a B is a 3.0, and so you can't get below a 3.0. So regardless, your GPA has to stay at a 3. Now, something that I feel like my program people might turn away from my program is simply because, so let's say in a normal 4-year program, say for instance you fail a class, you can go on to your next semester, but I'm pretty sure you just can't take classes that are prereqs for that class, I believe. I'm not sure how it works, but I would think that's how it works. In my program, you can't move on to the next step until you pass that class. So, let's just use my cohort for instance, because my cohort, we started out with 40 people and we now have 12, and we're 5 months into the program. So you do the math. But basically, a lot of them failed in Nursing Concepts 1. And what happens is, you fail Nursing Concepts 1, you cannot move on, because we only take 1 class a term. We don't take 5. You only can take 1 class. So once they fail Nursing Concepts 1, they had to wait until the next time around where Nursing Concepts was offered, which was a month later. So they had to wait an entire month, and now they're just now starting Nursing Concepts 1, and we finished that in the beginning of December. And they just started it this past week. So as you can see, it can prolong you. It can prolong you by 2 or 3 months. Whereas I think in a normal program, you might still be able to graduate on time. My program, it's just safe not to fail a class at all. And I know once we start getting into harder classes like med surg and mental health, they say those classes are not offered, but every like 4 or 5 months. And they go by GPA seniority. So if you have a 3.2 and someone has a 3.8, but they just failed last term and you failed 5 terms ago, you're not getting in the class they are. So it's one of those things as well. But that's also something to just take into consideration. You know, you never want to go into something having the mindset that you're going to fail, but you also want to be realistic with yourself, you know. And I knew that I could handle this type of pressure, like nothing for me. So that was good. But some people who are just like, look, I do better with having time to study. I do better knowing that if I fail, I may still be able to graduate on time. Do you? It's all dependent on that. So which program will be best? I'm in a RN program, so I'm in a registered nurse, an ADN to be exact. That's an associate degree of nursing. So you have ADN and you have a BSN, which is a bachelor's of nursing. So between those two, for me, it was just time. I wasn't going to stay in school for 36 months to get a BSN. I wanted to get to the money, so that's what I'm doing. I will be going back to school to get my BSN, but I just want to wait. I'd rather just get my ADN. To be honest, the difference between the two, which I've asked BSNs and I've asked ADNs, the real difference is your administration classes, writing papers and things like that. To actually do the job, you just need an ADN, and there's no different in qualification. Everything that a BSN can do, you can do on the floor. There is no difference. The only difference is, do you want to stay in school longer, or do you have the time to sit and wait? You 18, you fresh out of school, baby, go get that BSN. Just go do it. And you can do it at an accelerated nursing program, but just go do it. So it's all dependent on that. But then there is also LPNs and there's RNs. So an LPN is a licensed practical nurse, and an LPN, I know for my program, I think the LPN program is like 14 months and ours is 18. So there's a few classes that they don't take that we have to take. And then also, like, as for instance, pharmacology, they can't treat, or they can't give meds. So I don't think their class is as much as in depth as an RM class is, because we actually can give all meds. We can push med, we can do anything. They can't do anything with meds. But just to read this says that an LPN usually provides more basic nursing care, and they are responsible for the comfort of the patient. Whereas an RN, on the other hand, primarily administers medications, treatments, and educational advice to patients and the public. So basically the LPN is just going to give comfort care to the patient, whereas the RN can actually do, I don't really know the huge difference. I just know that LPN cannot give meds. If you're in the LPN program, you can comment down below kind of like what the difference is, because I'm not sure. I just know they can't push meds or give oral meds, topical. They can't give meds, period. So I think you just will have to research which one would be best. That also would get you out sooner, but it's only 4 months sooner. I guess if you're really, really pressed. But why not just stay the extra 4, become an RN, and make more money, That's just me, though. To each is his own. Some people are like, look, I'm good being an LPN. That's all I want to be. What DBA do you need while in nursing school? I already answered that. That's a 3.0. Nursing school test. Okay, so this is actually a good one because I'm going to be honest with y'all. Nursing school tests are tests that I feel like I've never seen before in my life. I've never taken a test like a nursing school test. And I'm just going to try to pull up an example of a nursing school test for y'all so that I can show y'all. It's not knowledge based. It's not like, hey, what organ does this? If someone's sick, what does this? It's more like critical thinking and scenario based. Scenario is the perfect word for it because every test that I've taken since Nursing Concepts 1 has to do with a scenario. A doctor prescribed this patient this medication. An 84-year-old woman coming in the hospital with this. So it's very, very scenario based. I feel like that just comes with the program. I mean, when you're a nurse and you're on the floor and you're in a patient's room and there's an issue or they're talking to you about something or you notice something's off, their respiratory rates are low or their pulse is low, you have to think about what is best to do in that situation. It's not knowledge based. It's not, So this means that their lungs, no. What do you do in this situation? So everything is very scenario based, which I feel like I'm starting to like. I'm actually starting to agree with it. And I think they said that the NCLEX has changed to scenario based versus what it was. And there's like no complaints on the NCLEX. So I love that. That was another thing. That was a question, was a lot about the NCLEX, which I can't tell y'all too much about the NCLEX because I'm going to be honest, I haven't even taken the NCLEX yet. But I do know that most people wait like a month to 2 months after graduating to take it because the NCLEX, you don't learn to take the NCLEX. You learn to pass your class. You learn to be on the floor. To actually take the NCLEX is not what they're teaching you in nursing school. So I know a lot of people take classes and order all these books. I'm probably going to wait a month before I take my NCLEX. Just because my school pays for it the first time around. That means I'm passing it the first time around. So yeah, I'm gonna wait a month, but I don't really know too much about the NCLEX. I know that you can pretty much take it whenever you feel like it, and you need to pass that in order to practice as a nurse. That's just that. You have to have that in order to practice as whatever you are. Yes, an LPN and an RN both have an NCLEX. One is NCLEX LPN, one is NCLEX RN. So they both take 2 different tests. And there are also, forgot to mention that there are bridge programs. If you get your LPN and you decide, hey, I want to become an RN, there's a bridge. I believe you have to meet the bridge though. If it's like 5 years, I don't believe you can take a bridge. You have to retake an RN program. Same for RN to BSN. If you got your ADN and you want to get your BSN, you can do that in a bridge program. You just have to make sure that you are not waiting too long to meet the bridge. Let's see. How to manage outside life with nursing school. I haven't even figured that out yet. I actually, and this is a question too, how to gain experience is another question. So I'm kind of going to speak on that as well with this question because I'm going to learn how to manage outside life when I start my new job, because right now I only have school, so everything else is an option. If I want to go out, it's an option. If I can't go out, cool, I just tell my friends I can't make it. So right now I have the luxury of just kind of studying and making it, and it's been working perfectly for me. I would just honestly say the biggest tip that I have, period, is do not procrastinate. I promise you the workload just continues to build on each other. And if you procrastinate, and on top of procrastinating on assignments and projects, you have to study for these hard tests. So you kind of want to stay on top of things. I also recommend looking over PowerPoints, lecture notes, books, ATI, before even getting to class. I'm starting to learn that myself, that when you kind of already have pre-knowledge on what your professor is teaching, the material is easier, the material comes to you better. And honestly, if you get a great professor, wonderful. But 9 times out of 10, you're not going to get the greatest professor. And that's just the honest to God truth. So you kind of have to learn how to work with these things on your own, especially in an accelerated program I can speak for. You have 5 weeks. These professors are teaching you 5 to 10 chapters in a day. You're taking tests. You learn something on Monday, you're taking a test on it the next Monday. You don't have time to only learn that information on Monday, study it on Friday. No, you're learning it on Monday. You should be looking at it Sunday and Saturday while you're studying for the other test. Look over the information, you get to class, you study the entire week. Also, during that weekend before, you should be looking over notes for the next chapter, because after you take your test on Monday, guess what? You're learning the next chapters. So it's just staying on top of it and really learning a routine. I kind of like to plan out how my day's going to go. Okay, I'm going to wake up, I'm going to do this, I'm going to study my flashcards, I'm going to do ATI, and then I kind of like to plan out what's going to be best for me. And you kind of have to plan out how your day is going to go, how you're going to study, how you're going to start studying for the next test. That's going to help you. And then as far as gaining experience, I recently just got a position as a PCT, which is a patient care technician. I got it at a Centera out here where I live. And a PCT, which I will read for you guys what a PCT does. Okay, so just a few things that they say, and then I'll tell you guys kind of about my position. But you want to, of course, keep the patient's room clean. You want to assist the patient with everyday needs. So if a call bell goes off and a patient needs to use the bathroom, you make sure that you go help them, because you don't want them to fall. Most patients in a hospital are considered a fall risk. Just letting you guys know that. Monitor vital signs, take fluid samples, blood samples, take them for testing, assist the nursing staff and administer basic treatment. You can do EKGs. They basically do things like that. You want to dress the patients. If they're a feeder, help them eat. Just help them on their basic living needs. And then you can also assist under the legal practice. So for my floor, I know a big thing that I will be doing is EKGs, because I work on a cardiac med surg unit. So EKGs, blood draws, taking, patients to the bathroom, feeding them, doing things like that. So that is a PCT, and I want to say that is the best way to secure a job out of nursing school. I mean, it just makes sense. You're a PCT, you're about to graduate, your hospital knows that. You tell them, look, take my NCLEX on this day. I want to work on this unit. You can stay at the same unit. You might want to switch. Easiest way to secure yourself a job. But also the easiest way to gain experience, because I'm going to be honest with y'all, the clinicals, you're not going to learn what you need to know. I'm not going to say they're bad, but you're not going to learn what you need to learn in the clinical. You're not going to learn the basic things, and also as a PCT, you can put in Foley catheters and you can administer and clean catheters. You're not learning that in nursing school. You might watch, but 9 times out of 10, you're not doing, So I would just recommend trying to get one. I know it's going to be hard. It's going to be different. I have to work part-time, so that's as much as I'm doing. I was not doing 312s. I have to do 212s, which I know is going to get complicated when I have clinicals, and I only have 1 day free throughout the week because the other 2 days I decided I have to work. But I'm going to have to do what I have to do because I need experience, and when I graduate, I want to be on the floor working. I do recommend trying to get the experience, because there's a lot of people in my class that do have experience that I just don't have, because I've never worked as a PCT. And as a PCT, the only way to become a PCT, take a PCT certification, which you have to take an entire class, take a test and pass it, guaranteed job, or be in a nursing program. Those are the only 2 ways. There is no other way. You can't just apply to this and become it. You have to take a class, pass it, or be in a nursing school. Let's see. What's the best way to study? Everybody's a different learner. I'm gonna be honest with you guys. There's some people in my class I know that listen and know it. There's some people in my class that do it so they know it. If you work in the field and then you're learning it and you go back to work, and next thing you know, for instance, I'm in pharmacology. I'm learning the medications. What if I go to work and next thing you know, they're administering epinephrine to someone? boom, that just helps me out for my test. So some people are learning through experience, but then people are doers. Some people are listeners. Some people are visual. You know, I know a lot of, I do get very good with videos. If I watch a video and watch someone making pictures and mnemonics and things like that, I learn better. I can't just learn by just sitting here staring at the teacher. Me personally, I can't do it. So I feel like you have to really figure out what works best for you to learn. But like I said, the best way I can give you a tip is just to start studying and knowing material before you get to class. Don't get to class and wait to learn the entire chapter, especially if you're a nurse, if you're an accelerated nursing program. If you're an accelerated, don't even try it. You're gonna need more than just the 3 hours or 4 hours of lecture that you get, or maybe 5. So just don't even put yourself through it. On top of lectures, you'll have simulation labs and skill labs, and clinical hours. Those are the 4 categories of my program. So we have to do lecture, and then we have sim hours that we must complete. It has to be a certain amount of hours. Skills. So the difference between sim and skill is sim, we work on a doll that has a a vital sign machine, and it can talk and things, and we have to do things on it. Skills is where we learn the skills that we're going to do in sim. And then lecture is what we're learning towards the book. And then clinical, you're just kind of applying everything. So it's a lot, but it's definitely doable. And I think you have to do your research on what program is going to be best for you. That's accelerated or a regular semester. And then also if it's LPN, RN, ADN, BSN, think about and research. You can write down on a piece of paper what the big differences are. What are the difference in treatment? What can I do? What's the pay difference? You know, think about everything that goes into it. And I feel like it will come to you as to which one will be best for you. Think about your situation, your living situation. If you have no support, no family, you got kids, you got a full-time job, you got a job on the side, you may not want to go to school for a BSN or even an ADN. You might want to just try to get in and out, and that might just be an LPN accelerated. But then again, accelerated might be too fast and you need a semester, so you might just have to do, you know, you just never know. So just research what is going to be best for you. But that is kind of like my program. I feel like I pretty much touched everything. Is there anything else I can talk about? I don't believe so. Just study. Stay on top of your studies. Don't try to be besties with everybody in nursing school. People are in competition with you. I'm going to tell you that now. There are people that will be in competition with you. And if you make a better test grade than them, if you make this better than them, they on you. They watching you. They want to know your grades. You only going to have about 1 or 2 friends. I got 1. Well, I have 2, but one of them is in a cohort below us. So one person is about the person I share all my grades, and we talk about everything that we got, because people are in competition with you. They are. They don't want you to do better than them. But yeah, so think about what's best for you. Also understand that this is hard. Nursing school is not meant to be easy. And if it was easy, everyone would do it. So it's meant to be hard. It's meant to be challenging. It's meant to push you and to take you to different levels. Mentally wise. It's very hard. It's challenging, but it's rewarding. It's once you really get the hang of something and you learn and you start putting it together. Like, I'm at the point where I'm starting to put everything together. Not really, but things are starting to come together, and it's like, okay, I know what I'm talking about. I feel like I know this makes sense because this happens and this. So, but just kind of think it through. And yeah, I feel like that's everything. If you still have more questions, please feel free to DM me. I will literally answer anything. I'm not a gatekeeper. DM me on Instagram. Follow me, DM me. And yeah, make sure you guys subscribe though, because I am going to be dropping so many videos and I'm super excited to just get on my YouTube stuff. And yes, I will see you guys in the next video. Peace.